Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hi, I'm Dr. Amy Brenner. Welcome to another episode of HealthiHer. And on today's show, we're going to be talking about something really fun about shocking your penis. And my guest today is Jim Glazner. We've been friends. Jim, how long have we known each other now?
We met years ago, and when we were doing the vampire training for the O-shot, P-shot, and the vampire facelift.
Yep. And you're the owner and CEO of Prescription Aesthetics, which is in Birmingham.
Yeah, Prescription Aesthetic and Wellness. Yeah, we started in 2007, mainly because we saw that, of course, cash flow as far as generating instead of waiting for insurance to pay was going to be much different. And so we started with that philosophy of just a cash pay medical practice, aesthetics. And in just 9 months grew from 900 square feet to 3,200, then went to 8,000. And now we're looking at adding a plastic surgery center also. So it's done really well. We've had a good time.
Your practice has just experienced phenomenal growth. And I know you're really good about making things affordable to your patients, but it seems like all the good, obviously I know people love to use their insurance, but all the quote, good stuff, unquote, doesn't seem to be covered by insurance. So
right. It's like when people call, they're like, is this covered by insurance? I'm like, believe it or not, insurance considers this cosmetic. And it's just like when you would go get Viagra, before it was generic, and it was only like $60 a pill, very affordable. So
let's start talking about Shockwave. I think people are probably shocked by the title of this podcast of Shock Your Penis for Better Erections. It sounds kind of scary. So why don't you just
kind of scary, but guys will do anything for a better erection. So
that is true. So why don't you just give us a little overview of what shocking your penis is all about?
Well, about 4 years ago, we received a study out of Europe. And the study was talking about how it was a small study. It was 30 men that were given using the real device, and you had 15 using a sham device. And they did 3,000 pulses. And then at the end of the 6 treatments, they measured the blood flow to the penis. And of the group that had the real device, 29 of the 30 had 80% blood flow, which is a full penetratable erection. There was only one that only had 4%. And then on the sham group that didn't have the correct device or a working device, they had 15 guys, but 14 were still at baseline, which I quite frankly thought all would be at baseline, and one had gone up 4%. But they didn't give us medical history, so take it for that. You may have had this guy may have lost a little bit of weight, blood pressure down, and so he had a 4%. 4% is not a penetratable erection. On the other hand, of the 29 guys, that was a huge success, but one only had a 4% increase. Same situation, may have had other health issues, diabetes, other things that were playing into it. But it got me working on this to find more about the Shockwave. And as you know, the device was in the United States, but not FDA approved for ED. It was approved for ligament, tendon tears, orthopedic injuries, because it causes what's called angiogenesis. Now, angiogenesis is where it opens up more veins, and it can knock out little flecks of plaque that were really kind of cutting off vascularity out of subsidiary veins. And so I went after, really, Amy, you and I talked.
So this is how it all started, is you read this study and then
I read that one study.
You read that one study and then where'd you go from there after you read that study?
I was doing testing. I'm on the speakers bureau for Allergan also for Cool Sculpting. And we had a device that was a Shockwave device Now, shockwave is not like a shock. It's actually a sound wave, and it is the sound wave itself is breaking the sound barrier. And so this sound wave actually causes the reaction. And so we were using it for cool sculpting to standardize and kill more fat cells immediately after we did the treatment. And we were having
I see.
excellent
So you
results.
got into it of using shockwave for cool sculpting, and then you started reading the data of shockwave for erections.
Right. I had a doctor who sent me this one study, and that started it. And then, quite frankly, the study, it intrigued me. I actually started going into that, and I went through everything that I could pull up that day, and using the device that we had, which was incorrect, but it was a shockwave device. It was actually 60% incorrect. I actually treated myself. I had my person treat me. You can't do it yourself. Treat me, and of course, like I said, it was 60% wrong. I just wanted to see.
What do you mean
hurt.
60% wrong?
You have to have a certain amount of millijoules and a certain amount of energy, and this machine, this device didn't. It was 60% incorrect, and the spot size, in other words, that treatment head needs to be 15 millimeters, and this was 39 millimeters. It was huge, but it was for a broad area. And so, we did the device on me, and I just wanted to see if it would hurt, because I didn't know, like you and I had talked, I didn't know if you needed numbing cream, you needed any of those things to perform it, because in Europe they had used numbing cream. But I did it, and it didn't hurt in any of the spots. What I didn't expect was, since it was incorrect, to see any results. The next day I saw something.
Gotcha.
Not like you just took a Viagra, but
so you had a shockwave
something.
device, and you were using it after cool sculpting instead of just using your hands to massage the area. Then you read this paper of shockwaves working for ED. Let me see if my shockwave for cool sculpting can work and make erections better. That's how you got started on this journey?
Totally. And so I actually made the phone call that day to one of the shockwave companies. The company was Zimmer, which I saw that was one of the main ones used over in Europe. And I ordered a device that day. The salesman that I'm talking to actually thought I was crazy, because they had no idea that it was being used for ED. In the United States, since it wasn't FDA approved at that point, for that, the sales reps were not even able to discuss what had been done in Europe. And I really started going further. I found 51 studies that had been done in Europe, all with the similar results. One had 600 men in it, 65 plus in age, that were not reactive to Cialis, Viagra, or injectable. They weren't allowed in the study if they had even used them in the last 4 months. And then they tracked these guys they did twice a week for 3 weeks, then they were off for 3 weeks, then twice a week for 3 more weeks. So a total of 12 treatments. And at the end of that time, but they were only doing 3,000 pulses. At the end of that time, Amy, they said 60% of those guys had 80% blood flow. 60%. Then they took the same 60%, a year later, and they were still at 80. A year after that, still at 80. COVID messed it up this year, but right now we're showing that it lasts at least 3 years.
Yeah, that's what I really like.
So you don't have to keep doing it over and over and over again. You're there.
Yeah. That's what I really like about shockwave is it does have all the science behind it. Like last I checked, there was over 60 published papers of showing the efficacy of shockwave.
Yes, and there has never been an adverse effect ever shown in any study. I did a study here with Dr. Gold, Dr. Beisman, and Dr. David Goldberg out of New York. All of our patients treated, it was mild to moderate ED, had phenomenal results, and no adverse effects. I mean, it's just, we've pushed the numbers even higher to where we're doing, 12,000 pulses, getting, results, and the providers that we've trained, they're getting an average about 85% success nationwide.
Mm-hmm. Yeah. So you and I met when we were learning a different therapy for ED called the P shot. And you and I were talking earlier this week of, I think I agree with you. I think there is a place for the pea shot and I think it helps, but I really like that there's science behind Shockwave versus surprisingly, unfortunately, we don't have any published studies on the pea shot, which is using platelet rich plasma into the penis.
Right. And to this day, we don't yet. But I have people that come in requesting it, but I have a tendency to push, let's do the wave therapy first. And these guys are always so happy with their result. ED is going to happen to every man on the planet. I mean, the studies show that it's going to happen to 50% of us at age 50, 60% at 60, 70% at age 70. And so it's going to happen, but a lot of it plays into the fact that when we were younger, say 12 to 35, you had 4 to 7 nocturnal erections a night. And then from say 35 to 45, that drops to approximately 3. 45 to 55, maybe 2 a night. And then by age 65, no. And by age 65, we've also actually lost half the volume of our penis, as well as only having about 10% blood and oxygen flow to it. And that just comes from the fact it's like having a bicep that's not exercised. You look down, it's still there, but it's not the size that it was because of lack of blood flow. And so all of these things are obtainable and you can get them back, but it's just a matter of finally we've got something that brings the intimacy back and the spontaneity without having to pre-plan, without the side effects, headaches, stuffy nose of, Cialis, Viagra. I mean, it's like, everything has a side effect, but to me, like you and I had discussed, the biggest side effect is if you in the middle of the night just said, this is the time, you can just do it. Whereas when you have to pre-plan, it kind of takes away from the partner because we know that there's another factor that's playing into it. And it's not the other partner that's causing it.
I agree. People, or at least the male patients that I've seen, they don't like the pre-plan. I use a lot of daily tadalafil or daily Cialis because I think it also has a lot of just overall health benefits by increasing nitric oxide.
Really does. We prescribe 5 milligrams just a daily.
Yep. So I really like that. I think that really should be something for almost everybody. But people don't like the high dose Viagra or Cialis where you have to plan an hour before. Like you mentioned, it has a lot of side effects.
And they wake up the next morning and they have a horrible headache. And I had one guy tell me, he said, every time that I use Viagra, he said, my nose is so stuffy. And he said, Viagra works sometimes, it doesn't work others. I said, now you just said it made your nose stuffy. I said, do you ever do anything to stop that? He goes, well, I'll use Afrin nasal spray. I said, you do realize that's the counteract to, I said, so we figured out why it doesn't work sometimes. He goes, you're kidding me. I've been wasting that much money on a pill. But he had no idea. That was the counteract for it. Sudafed and Afrin nasal spray.
What's interesting, though, is I think a lot of PCPs or family physicians or urologists, their go-to is the high dose, take an hour before sex, Cialis, Levitra, Viagra.
Or the shots.
Oh, yeah.
The problem with the shot is now, and this is what I really want to drive home. It's called Trimix. It causes an erection. My patients tell me it doesn't feel like it's them. It feels like it's just over full.
And let's just clarify, this is an erection an injection that goes into your penis.
Your penis. And
before sex.
We know, right, before sex, and it works, but 10% of the guys that do it will develop scar tissue in the areas where they've been injecting, and it will cause what's called Peyronie's disease. Now, Peyronie's is where it builds up plaque in the penis, and it actually will cause it to bend up to a 90-degree angle, which means that penetration is next to impossible and painful. So, but 10% is a large number.
Do you prescribe Trimix in your clinic?
Probably only about 6 a year, mainly because I educate the patients, and I'm very, they need to know what they're looking at. I would say the few that we do are they're in their 70s. And so it's not like they're doing it 2 or 3 times a week. It would be, just very rare, but I'm very cautious about it, mainly for that one reason.
Yeah, that's one thing I've never got into, just because you can end up in the ER with, a persistent erection that needs to be drained. So I just don't want to have to deal with that potential complication.
Well, and that is I had a wife who they were going to another clinic, and she said that when her husband would go to sleep afterwards, that she would actually stay awake because she was so fearful that it would not go down and it could be permanently damaged. And in permanently damaged, it will. We had a patient that we did not prescribe it, but who called us after the fact, and he had evidently used it 2 or 3 in the morning, and around 6 a.m. it still wasn't down. Called the clinic that had prescribed it, and they told him to get to the hospital, and he was very embarrassed, and so he thought, I'll just wait till the clinic opens at 9. He shows up at 9, and they immediately get him to the hospital. His penis is now done. I mean, it's like it would be like having a tourniquet on your arm for 2 days.
Yeah, that's not good. I just haven't had a need to go down that road. I'm sure there's a place for it, but at least the patients I'm seeing, they haven't done the things that don't have any side effects, like Shockwave.
If you can fix it, Amy, and that's why you came to me, for the course. If we can fix it, that's everything. I mean, it's, you and I discussed, years ago, 2% of our relationship, there was a study done 7 years ago, 2% of our relationship, or any relationship, involves, the intimacy of sex. But 98% of that couple's satisfaction comes from that 2%. And so it's not that we're shallow, it's that closeness and that oneness, and the fact that both partners are causing and getting that satisfaction is everything. And so, it's just a matter of bringing that back. And really, quite frankly, the pills and the injections made it possible, but they're doing it at a cost. And the intimacy was everything. And the fact that, like I said, you could roll over in the middle of the night and it was there is the way it was when we didn't appreciate it when we were, 20s. But it's possible again. So
yeah. So you and I met each other learning how to do the P shot, and then we've stayed in touch, and you got into doing Shockwave much before me. In fact, you mentioned you started actually teaching the courses, and then you called me and said, you really need to do this. It's Shockwave is making cool sculpting, getting faster and better results, as well as it's a great thing to add to the P shot, because what I found is the P shot helps, but there were so many more men that they needed something more than just the P shot or PRPs. So we had to start offering other solutions where the P shot just wasn't going to be enough for them. So it's been a really good addition.
Yeah. We've trained over 550 offices how to do this now. And I do the course every month, but we've also, and of course, the O-Wave, to where we're doing really the exact same treatment on the vagina and getting incredible results with that. The O-Shot is phenomenal on its own, but when you add the O-Wave to it, the results are so incredible. And women come back, quite frankly, usually within like 3 months wanting another one, and they haven't reaped their first benefits yet. It's still coming, still working. So
yeah, I agree. I think as with anything, when you start combining therapies and doing different modalities, you just multiply the effects. So with women, are you typically, when you're combining it with an O-Shot and calling it O-Wave, are you doing 6 treatments like you're doing for men?
Well, you could, but actually we've had, I would say, a majority of the women, we've done it. We do it prior to the O-Shot, immediately before the O-Shot. And we've had a few women who wanted additional treatments, but a majority reaped so much from the combining the two modalities together and it's giving them everything that they, I mean, vaginal lubrication, they're noticing, tightening, as far as like incontinence, it's like helped on that. But the orgasms are so much more intense. We had one woman, and she was early 50, and she was telling us that when she came in and she was looking to get a second one at 3 months, which she did not need. I mean, she said that she didn't realize she had never truly experienced an orgasm until after this treatment. She said, and her husband gave her the credit card to come in and get another. But she said that it was nothing that she had ever experienced. She did not know that she had been missing that. And that's a shame.
Well, that's interesting that you bring that up, because I really like to, screen those people out when I hear I've never had an orgasm in my life. Like, that's when I start thinking that, maybe we need to go back to the beginning and maybe see a sex counselor. So,
but in her case, she did not tell us that she never let on until after she had truly had one. But she came to us and she was a little worried. She said, I'm developing an incontinence issue. And of course we're like, so when you exercise, when you sneeze, when you cough, and it was like, no. She said, during. It's like, during what? She goes, at that moment. And it was like, sweetheart, you don't have an incontinence issue.
Gotcha.
So, but I mean, it's just like I said, but I really do feel that someone like that, and it's not often, but when someone like that was a very rewarding day from the fact that, she had experienced something that she never had. We told her we wouldn't do another one for 6 months.
So people are getting side benefits, not side effects, but
Absolutely.
Side benefits.
Yes. Mm-hmm. Well, we told her, we wouldn't, we needed to wait at least 6 months so she got her full benefit. The day of her 6th month, she was here with her best friend to both get it.
I know. It's interesting. Women will share, like, look what I did, that kind of thing. I don't know if my male patients are really sharing that. I had the Shockwave and it's the greatest. You should get it. Is that happening in your practice?
Well, they definitely are going to go do it together. No, in our practice, I did a lot of radio in the beginning just to let people know this was out there. And I do approximately 10 patients a day. We've got, 4 devices in the building. And so I only take the very difficult cases personally. But now we're not doing any advertising at all for it. Everything comes from word of mouth. All right, I'm 61, but I know that all my buddies that are exactly my age are experiencing the same issues. But, if I were to go in to see me, and I would not mention it to any friend, number one, I don't want to end up looking like I'm foolish that I spent money on some crazy treatment. But when it works, they tell an average, I would say about 2 guys, they tell their best friends. And they're here, and it's a matter of, Bob told me what you did, and I've had this issue, and, I've been doing Cialis, or I've been trying Viagra, hated my side effects. But it's the results are so good. So, that's.
Now, are you seeing people? I know you mentioned that you did it. I periodically, my husband is now 53. I like to have him come in here, and I like to do this treatment on him because, as you mentioned, like, it's inevitable. It's gonna happen. ED is gonna happen unless you really go out of your way to kind of do these treatments. And so I also have some people that come in and they don't even have a problem. Everything is working just fine, but
But who wants to have one? You can head it off.
Yeah.
Amy, we don't brush the teeth of a 3-year-old because they have cavities. It's to prevent later.
Well,
why would you not do, say, one of these a year? Just because my body optimization guys are what I call them, and they come in, they just want to be. These are the guys that, their diet is great. They work out 4 times a week. They do this, and they'll come in, and they're generally are like, can I just do a monthly deal of coming in? And I'm like, we can, or just do once a year. But, majority of them, like I said, they're at that heightened body optimization that they want to do one a month. And so actually I worked up a program that, it's kind of like a subscription deal that's this much a month, and they just come and we do it.
like, just like with everything, just like going to the gym, maintaining your weight, like maintaining your erections, maintaining your vaginal health. It's so much easier to maintain it than wait until there's a problem and fix
Exactly.
it. So,
Well, with me, Amy, I am 61, but I am extremely fit, lean. I mean, I've always, I got into this business because I wanted to do nothing but buy toys that I thought Botox, fillers, everything that I was interested in, I thought everyone else would be also in aesthetics. And when ED happened to me at 55, it was a shocker because this is something that's
yeah, it's
supposed to
not
happen
supposed to happen to a healthy
not to
person.
me. I mean, my
Exactly.
diet's great. I mean, it's like, I'm fit. I mean, blood flow should be there. But like I said, the good thing is you can fix it. And that was my main goal was I didn't mind if I never treated a guy, but if there was a machine out there that could fix it, I wanted it. And so, and that's also kind of a problem now. You and I discussed, there's other companies now jumping in, acting like there's a home model. And, I've seen some of these and they're quite frankly substandard. And it's kind of like if you were to, and some of them even have the Zimmer name on these devices. But it's kind of like if you bought a Rolex on the streets of New York for $25, it says Rolex, but don't get it wet.
Yeah.
Yeah.
Yeah. Fake purses on the streets of New York City. I
Right.
remember that shopping, and yeah, you kind of get what you pay for. Well, there's a lot of home aesthetic devices. I've seen infomercials for home laser hair removal, home fat freezing things, and if it was that simple, everybody would have it and everybody would be using it. I'm just not a lot of those home units just don't give
The
you
home
the
units,
results.
no, they don't. And of course, there's a different. I'm sorry, if there's $30,000 difference in a real model and a and a home device, there's going to be a difference.
Yeah.
So
Now we send our patients home with a home vacuum erection device or penis pump, and I
well,
know
but what
you.
that is, yeah, I mean, what we call that, I consider that just yoga for your penis. It's just exercise and getting blood and oxygen in and out. But there's nothing wrong with that, but that doesn't fix it. But if you've got the blood flow from the wave therapy and you throw that on top of it, it really, the angiogenesis that I talked about in the beginning, where we're creating more vessels, if we
Mm-hmm.
put the vessels that are under pressure and it's forced to create new, it does help a lot. And with some of those individuals that have developed Peyronie's, where they've actually, fractured the penis or from the injections, Shockwave has been amazing for that. We can get about a 70% correction in Peyronie's disease just from the Shockwave. And by throwing in the pump, that does help straighten also.
Do you get weird looks of telling your male patients to use the pump, or have an issue with compliance of using the pump?
I don't, because they look at me and I'm like, I use this, and of course, I fixed this years ago, but I'm smart enough to know that with any exercise program, there's nothing wrong with. I just do it once a week now,
Right.
and it's at the end of the day. I'll tell my
Because you're
wife I'm
just
going to do my yoga.
maintaining.
You're
Yeah.
right, but I'll tell my wife I'm going to do my yoga. I'll be right back. She laughs, I laugh, and I'm back there checking my emails. But it's a matter of, like I said, you're just maintaining and you're doing what's best for you and your relationship. And
So
when a
some
guy finds out that I've had ED, you know, they understand that I've got the empathy that I understand how emasculating it is, no matter how fit you look, that it doesn't work.
Yeah.
So, and I tell them, I'm like, I will fix this.
Yeah, I don't think it's anything to be ashamed of. I think it's
No,
something
no.
I kind of look at it as in the same vein as Botox and fillers, and my face has a lot of that stuff in there, and because I can't undo the fact that I'm 51 now. So aging
Well, you,
happens, and so
you you look amazing. You do not look 51, and you know it. And and
well, I work at it.
well, we all do. But I
Yeah.
mean, we are the largest injector of Botox and fillers in Alabama. We're part of that the elite group that I think there's only 5 of us on the southeastern seaboard. at our level. But I mean, there's nothing wrong with doing that. We've got probably, and I think it's because of me, probably about 40% men that we do. But why would you not keep up your appearance? No one wants to look old. And every now and then I'll have somebody say, well, I think we should age gracefully. I'm like, well, quit brushing your teeth. They'll fall out.
I know, right? Yeah, it's not acceptable, for the paint to be chipping off your car or your house. But for some reason, sometimes people, I don't know, feel guilty about spending money on yourself. Although I haven't seen that guilt in sexual wellness.
No, quite frankly, Amy, I told you once, I would forego a new car for my penis to work.
I know,
So
right?
I mean, as far as expenses go, I have much more desire for it to work than to have a new car. So, I mean, it's just, and like I said, but when it doesn't work, it's all you think about. And that's why, guys need a solution. And, and when I'm talking to someone, I'm going to fix this. And fixing is not, we're going to treat, we're going to fix it. We're going to fix the problem.
Yeah.
That's all
you really
I want to hear.
You're fixing the problem. You're not just giving a pill or a shot and just treating the symptoms, but you're opening up new blood vessels, getting rid of like little, what's the word? Microcalcifications in the blood vessels, and opening up the blood vessels. And it's just so different when I see people at the first visit. I think sometimes people are a little embarrassed, kind of slunched over. Then they come back and we talk again after they've had several treatments, and people are like skipping down the hall. They got their pep in their step, like their facial expressions.
They're bringing their wives in because they want to meet you.
Yeah.
Because I mean, it's amazing. I had a 77-year-old post-prostatectomy, has prostate removed, patient who was non-reactive to Viagra, Cialis, or the injectable, the highest dose. And he was scheduled November a year ago to have the pump put in, where they actually gut the penis and put in 2 flex rods, and it lifts and lowers a flaccid penis. And he took a chance on this. And I told him, I said, as far gone as Sam was, I said, it's going to be 12 or more treatments. And at 12, we weren't seeing anything, but he was very far gone. And I kept going. And at 17, he had his first nocturnal erection in years. And at 22, he's functioning. I mean, the guy made a video for me. He said, he said, if you can make this old fart work, you can make anybody.
Yeah.
That was in his video.
So how many treatments did he end up needing before he was able to
22.
have
22. And I mean, it is like he became 5 years younger instantly. Because when it didn't work, it made him feel old.
Now, are you using a shim score or any kind of formula of how many treatments?
Yes, erectile heart. But I mean, you can almost, if I have a guy that comes in and tells me that Viagra and Cialis work, but just okay, or would rather not use them, that's going to be someone that's always going to be about 6 treatments, always.
Yeah, and their scores are usually around 20 or above. Would you agree?
Exactly. But if I've got a guy that comes in, he's not reactive, they don't work, I want to set an expectation. It's going to be about 12 to 15 treatments, just so that they know. And I really don't want them expecting anything the first, treatment ever. But we did an exit poll of 385 guys on their 6th treatment. Some of these needed 12 or more. Some only needed the 6. And this was the day of their 6th, because a lot of these guys will never need to come back. I mean, they're fixed. And so the biggest thing was almost all of them said that by their 3rd treatment, flaccid and warm, it was thicker and longer. Now it's holding more blood. And so it's not going to be thicker and longer than it ever was, but it's getting it back. But the big thing was 78% of the guys that said that Viagra and Cialis they had to have said they no longer needed it. The 22%, because we're guys, I don't know if they need it as a crutch or if they, exactly why they did. But 78% said they no longer needed it. Of the guys that it didn't work on at all, 68% said it was now starting to work. So really at 6 treatments, we've taken at least 68% up to 1 level higher. I mean, if it
Yeah,
didn't
that's
work and
great.
now it works, that's pretty good.
You got to
So
publish your data. That's great data.
yeah, we've had so many. And the thing is, we're working on another study now, but it's the data is there, but it's all I want to do is back it up with about, I don't know, 100 of my guys telling how it's changed their life. You can read a study, but when you hear them tell their stories or bring their wives in or show up at our holiday open house and they're in the lobby talking to others, Jim saved our marriage. Do you realize? I'm like, and they're talking about things I never would have just talked in public about. But for them, it was so life changing. But it's
Yeah.
like I said, Amy, the whole goal, when you wake up every morning and you're doing something that changes someone's life for the better, it's not like you're just going out there and, you know, you're changing their life and you're getting it back and
it's interesting
helping their self-esteem.
Maybe before they didn't think this. I mean, they knew it was an important component of their life, but then when they get it back and they get their intimacy back with their partner, they didn't realize how important it was to them. They knew it was important, but then when it's back, it's just, they just want to shout it from the rooftops.
They do. And that's why, like I said, I've stopped advertising because, I mean, it's much more important for me when a guy comes in and he was referred by his buddy, mainly because this guy, he doesn't have any doubt in his mind. He knows from Bob or Bill that this works. And, it's just, and the fact that they would actually refer someone, I tell my guys, I said, I cannot tell you how much I appreciate it, but, what I'll do is I'll just put a free treatment on your chart in the future, and these guys may come back a year later just for the heck of it. They're getting ready to go on a trip or something. They just want to do one before they go, but they really don't need it. But, they appreciate the fact that I would, actually, throw that back to help them because, I mean, I just, like I said, at the end of the day, you sleep well and you did good and you've helped people's lives.
Yeah. And that's why your practice has been so successful is you get great results and you're only bringing in treatments that actually work. And I know over the years, you and I have been friends, you've had stuff in your office and you got rid of it and you sent it back because it doesn't work and you don't want to put your name behind it.
Yeah. And I've had, there's a graveyard of things that, I mean, you're going to have that happen, but I mean, and then I'll get calls from device companies that want me to put my name on it and want to pay me, but I don't even believe in it enough to use it myself. And there's like, I'm not going to do that. I mean, I'm not going to, you drop your standards to that level and you never can go back.
I know you're super busy and we're almost out of time of the time you said you had to give to me, but for our listeners, I have two other questions that I want to make sure we address is because it sounds painful. I wish it wasn't called Shockwave because the name sounds awful. It's kind of like microneedling like that or RF microneedling. Right. Like those are the worst names, I think. I think just the names are scarier than the actual procedures. So if you'll just describe for everybody like what a shockwave feel like, because it's not something to be afraid of.
No. It feels like a mild thumping, but it's the sound wave that's actually penetrating, and the sound wave doesn't stop movement until it hits something of different impedance. And so in other words, it continues to travel at the same speed until something stops it. And like I said, the very first time I did it, I wanted to find out if it were painful because I saw in Europe that they were doing numbing cream. And
I know people ask me about that because I don't know if some places are using numbing cream, but there's no reason to use numbing cream.
Well, what I see is I think of some of these offices that are busy are trying to kind of delay a patient. So a patient sitting in a room 20 minutes numbing while they're seeing 3 other patients. And so then they come in, they do this, but I have had patients that I have used numbing cream on just because they requested it. And then the next time they humored me and did not use it, and they felt foolish that they had ever tried that. They said, "This is nothing." I'm like, "It's nothing."
Yeah.
The results are there, but it's just
the downside of the numbing cream is then you're numb all day. So,
and by doing the sound waves, it actually includes it, makes it go deeper. And the biggest downside of that is really for about 12 to 18 hours, it may feel like you've got your feeling back, but if you attempted to have intercourse, it's not, you're going to feel like I've stopped you from having it. It's just not, you won't have the good, you don't have the sensation.
yeah.
So
Have you ever had any negative outcomes or side effects or complications? I mean, we have everybody with every procedure sign a consent form, and we have one for this, but have you ever had anything?
I haven't had anything by doing the Shockwave. The only thing I've had is guys try to, more is better. And I show them how to do the penis pump, tell them how to do the penis pump. And I've had guys that have over pumped. More must be better. If 10 minutes and then, a 10 minutes would be fine to be an hour. No, it's not. I mean, that's the only thing that I've had an instance. And they had, some swelling just because they overdid it.
Yeah, but nothing from the Shockwave itself.
Shockwave.
Yeah,
nothing.
Same.
It's all been so positive. And that's, and like I said, just from the studies, never a negative adverse effect. So,
yeah, that's what I tell people. The only negative side effect is this device is loud. So it might hurt your ears a little bit. That's about it.
So, but yeah, I really appreciate you having me on, Amy. We got to come on and talk about some other things too.
I know. We will. Thanks for joining me.
Thank you. Have a good day.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.